If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hi, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 15th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It is more important than ever to be an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, by calling the live phone line at 718-499-6101. The second, now you can email us. Email your questions to askthetoctor@netny.net, and we'll bring them into our discussions. Also, new, only for this season, is the Net Viewer Survey. And this is something we're conducting, and I need you to take your time to complete this survey while you're waiting to get on the air. Now, the survey's here because we'd like to have your opinions on net programming. So we know that you come up to me, and we've met so many people in the off-season who love Ask the Doctor. And if they want to see this show continue, it's necessary to fill that survey out because they're looking to see which shows are bringing in the most callers and the most people. So I know we have a very popular show, but if you don't fill it out, it may not work. So please go ahead and fill those out as you're waiting to get on the show. Now, there's another way to get it in. I'm going to tell you in a while. You can mail. I'm going to give you an address because I know a lot of our viewers are not computer savvy, but there's no reason they can't mail it in. So they can mail it in. There's an email on the net website where you can mail it in. So we'll talk about that a little bit more in the show. Now, for this episode, it's really great. This is one of the best episodes you're going to see on this show. Dr. James Sconzo, Chief of Dental and Oral Surgery Implantology at New York Methodist Hospital. I like that implantology. Sounds like some reflexology thing. Yeah, we got to talk about that. Then we've got Dr. Emil Bakish, no stranger, I think about 6, 7 times on the show.
Yes.
And he's the Medical Director of Rehabilitation at the Center for Nursing and Rehabilitation. But before you say that title, people are leaving you. I don't know what's going on. And Dr. John Heitner, again, another one of our favorite guests, Director of Non-Invasive Imaging. And basically, he's a cardiologist that does non-invasive imaging. So we want to get your questions about cardiology, and he can tell you how, through non-invasive means, you can find out if you're sick or not. So it's great to have you here. In the news, it's been kind of a slow week, but a couple of interesting stories out there. Can Starbucks make you happy? And this was for women who were in their 40s and 50s, and it seemed if you drank 2 to 4 cups of coffee a day, caffeinated, that you were less likely to be depressed, about 30% less likely. So we're not sure, is it because of the coffee? Is it because of the group who shops for the coffee? Or is it people who are used to coffee to stay up late at night? Or is it psychological? Nobody knows. They're just reporting that cohort, or that group of people who drink 2 to 4 cups of coffee a day, caffeinated, who are women, are less likely to get depressed. So women out there, you know, doesn't harm if you want to take it. What about that, John? What do you think about coffee?
I personally don't take it myself, but I have nothing against it.
Right. I mean, a lot of people are worried, can it affect their heart and so on, and we'll talk about that in a little while. Now, also, heart attacks in children and men. Dr. Heitner just showed me a picture of his 5-month-old, Savannah, and it seems that men who have children are less likely to get heart attacks.
Yeah.
So
It's good news.
who knew? You know, our parents used to say I would drive them crazy and eat their hearts out and so on, but apparently men, now this is for men, this is for the husbands, their children that have children are less likely to get heart attacks. So, interesting thing. Then another thing that happened today, I have this eye here. You're wondering, I'm sure, oh, there goes the lens. But what we have is people who are traveling in space, astronauts who are spending their long periods of time there, are coming back with blurry vision. And it seems that the fluids that normally run up and down because of gravity are pooling in the head, and it's causing a congestion in the brain. And the nerve from the eye comes out from the brain, the back of the brain. So here's the nerve, and what happens is that this gets inflamed and it doesn't get enough oxygen, and it begins to die, and you get blurry vision. And some people, it's not coming back. Some of the astronauts are having persistent blurry vision. And what's scary is a lot of them don't want to report this because they get removed from the space program if they have eyesight problems. So before we send someone to Mars for a 3-year trip, we're going to have to figure out, there are medications they can take, surgical procedures, but definitely something that's going to have to be addressed. So blurry vision by the astronauts. Of course, I want to say hello to Monsignor Bennett. Monsignor has been here. We have 15 seasons. He missed one show in the entire time. So Monsignor, it's great to see you out there. We spoke this week, and we'll talk a little bit after the show. Thanks for coming. Then a very special person, Joe Stiles, 94th birthday. This man is amazing. He's active on all the, I think we might have, hello, Joe? Joe? Now, somebody told me Joe was there, but I got a surprise. He's not there. Joe? Okay. All right, but anyway, I got to tell you, this man is amazing. He's on the board of Community Hospital. He's the Knights of the Holy Sepulchre. He's an active member, and he's just a great guy, great to talk to, and it's great to have him as a friend. So, Joe, thanks. If you come back, we'll talk to you. Now, we have a quiz. It's a little tricky this week. I know last week Linda Lapatosa gave us a tough one. How about this week? According to several popular surveys, what is the #1 most popular selling candy in the United States? So what candy sells the most in the United States? And there was such a demand last week for this beautiful work of art that if you look, here's the lungs, and if I turn it around, ask the doctor. Now this is a limited edition. I made a little fun of it last week, but Tarasia got a little upset with me, but I think, is this a beautiful thing?
Beautiful.
People would love to have this. So in addition to the plaque handmade in Japan, you get this Korean. We're heavily into Eastern culture. You're going to get this Taiwan shirt, and we're very happy to give it to you. So who's ever first is going to get it. Now, Joe, are you back? Joe? I don't know. Joe is having, Joe, call us back, and we're going to get through. We're going to let you, we're going to talk to you. Okay, so we're going to take a short break, but I want to stress one more time about this net viewer survey, which we're conducting. During this autumn season, we want to know your opinions. We want to know what you think of the shows you see, and we want to see what you think about Ask the Doctor. So I urge you to take a few minutes to answer the survey questions as you wait for to go on the air. And for those who could not get through, you can get on our mailing list. Please write to NET, 1712 10th Avenue, Brooklyn, New York, 11215, and ask for the survey to be mailed to you, and this way you can do it at home. Of course, you can participate online at netny.net. Your feedback is greatly appreciated. So just get ready, fill those surveys out, and we'll be around for hopefully another 15 years to come. Now, tonight's topics are oral and dental surgery, geriatric medicine, and non-invasive imaging. The number to call, and cardiology, as I said before, the number to call is 718-499-6101. Or you can email the questions to askthedoctor@netny.net. Feels like we did a whole show, no? We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
Welcome back to Ask the Doctor, where our topics are oral and dental surgery, geriatric medicine, and cardiology, and non-invasive imaging. Let's meet the doctors. Well, sitting to my left, we have Dr. Scanzo, who's dentist par excellence, and before we go any further, I have to mention the staff at his office is so patient and amazing. Barbara Balsamello checks you in, smiles most of the time. No, but really nice woman, tremendous. She's become a friend. I've been there a few times, and she's so nice, amazing. Allegra, it's a great name too.
Yeah. Happy.
Happy all the time, and always makes you feel good. You know, when you excellent. And Florence, who
my main assistant.
Main assistant. You cannot make this woman angry. The most kind, gentle person I ever met. So I want to thank them all for their help.
Thank you.
And so Dr. Scanzo, I see you brought something with you today.
I brought a couple of things. I figured kids are going back to school, soccer season starting, basketball, a lot of injuries this time of year. So I figured I'd bring a couple of things to prevent the injuries. Mouth guards.
Let me see that.
Very important.
I guess you wear this if you're going to box or what?
You wear that if you're bicycle riding, soccer, hockey, a lot of sports out there. Basketball.
Beautiful, beautiful. You showed me a picture. I got to show that picture quickly.
Well, the reason why you want to wear this.
Show that to our camera over there.
This time of season, we get a lot of dental injuries. Patient comes in, course, with the mother, the father, everybody's distraught. 15-year-old, boy got hit, baseball bat,
Whoa.
fractures a tooth. This is a lifelong injury that they have. So what we did immediately, we bonded it. That's a quick fix. But what may happen with this tooth, child may end up needing root canal. You need a post, you need a crown, a couple of $1,000s worth of work. So
This is why children,
cheap
I
little
can't believe
mouth
that.
guard, well worth.
But this thing here, now you're telling me this guy could eat an apple.
Absolutely.
A hard apple.
Hard apple.
Amazing, amazing. And it's amazing what dentists can do today. Just and relatively painless too, right?
Yeah. I mean,
excellent.
It hurt when he fell.
Yeah.
So we'll get into more dental
Sure.
applications and work. Thanks for coming to the show.
Thanks for having
And
me.
he swims in
Steve.
the ocean every day, right? Almost every day?
Just about every day.
How much into the season do you do that?
I go into November.
Into November? Wow,
Yeah.
that's amazing. Well, we'll have to ask the Dr. Cameras follow you out
There
there
you
and see
go.
what that does. Then, Dr. Bax, what can you say? He's been here, 7, 10 times.
Several times.
Always
yeah.
you call on and dependable, speaks the people's language, which I
Yeah,
like.
sure.
you know.
Very happy to. Thank you for inviting me.
You're welcome. And your son, I know, had a momentous occasion.
My son passed the bar exam. He's a lawyer. He's in practice now, in private practice of law. He's doing general law and criminal law, real estate
And
law.
in Park Slope, how much better could it be?
In Park Slope, exactly.
Right near
yeah,
your
it's
place?
terrific. Right near Methodist Hospital.
I think
Exactly.
he's near PS 321.
Right across the street.
So anybody that needs, what's his name?
Matthew Backash.
Matthew Backash. If you
Right.
slip and fall, does he do that stuff? No.
I don't know.
Okay.
You call him.
All right.
Sure.
So great of you to be here.
Oh, thank you
and
very
Dr.
much.
Heitner, I know that having the baby has to makes you feel so good, right? Somebody to come home for.
Terrific experience, just unbelievable. We're having a great time with it.
So I wanted to know, now, rumor has it there was a momentous surgery performed yesterday at the Methodist Hospital regarding a hole in the heart?
That's right. So patients, not uncommonly, there are patients who can have a hole in the septum of the heart. And today, actually, we had our first case where we were able to fix it by percutaneously, meaning taking a wire through the groin going up into the heart.
You're not cutting his chest open?
Not cutting the
Wow.
chest open. And they implanted the
Amazing.
device today.
So this is we'll talk about some of these things. I know you have out there problems. You don't know where to turn. You got Dr. Heitner here who's going to help you. So this is the scorecard. This is the lineup for the show. And let's go right to our first email from Gina, and then we're going to go to our busy lines. I've been diagnosed with Hurdle cell on my thyroid. Okay. First, fine needle aspirins results were negative. Second, came back papillary carcinoma. Got a second opinion from Sloan Kettering. Resulted in negative results. So now she's got sound like a negative, a positive, a negative. After a positive of papillary carcinoma, I'm 50 years old. What do you think I should do? So we have this, Dr. Backus, what do you think? We're getting different results coming in here.
Well, I would have the slides reviewed, the ones that show papillary carcinoma, to the main pathologist, whoever's reading them. And certainly, if you did have papillary carcinoma, you need to be treated aggressively, because it's not something you would want to just sit and wait and watch. So papillary carcinoma can metastasize and can cause significant disability, and morbidity can spread to your body. So I think that the pathologist has to give you a straight answer. That slide that showed papillary carcinoma needs to be reviewed by a very prominent pathologist to make a decision.
This just shows you what we say all the time, first, second, third opinions. Just don't stick with the first opinion. You got to go back and get another one. So
it's possible that on the other biopsies, they didn't get the same spot. So that slide is very important.
So now we're going to see who's the first caller. I think it has to go to Joe Stiles because he was on the phone. We missed him. So Grace, I believe Grace is going to be our second caller. Hi, Grace.
Yes, doctor.
How are you doing tonight?
No, not too good. That's why I'm calling.
Oh, that's what we're here for. What can we do for you?
Yeah, I had a flu shot, which I've been getting for years because I'm 77, and they advised to get last year I got no effect. This year, I don't know, I feel a flush face, head pressure, like a lot of migraines. I got to lay down during the day. I'm very weak, but these flush faces, especially when I eat, my arm bothers me from the beginning. It was a slight itch. I thought that I wouldn't mind just that, but I can't stand the flush face.
All right.
And migraines.
Grace is
and
not
I went
having
to
a
the
good
doctor.
day.
I have high blood pressure.
Grace, So how come the age keeps changing? What was it? Grace's age is...
I'm 77.
77 tonight. Okay.
Yeah, I've always been 77.
Grace, so what, the flu shot, complications, Dr. Heitner, Dr. Backer?
Sure. I mean, I give out hundreds of flu shots every year. They're very, very safe. I mean, some patients report, minor versions of the flu after you give them a shot, but that's unusual. And if you do have flushing, you can just treat it symptomatically with Tylenol or Advil, and it'll pass. Just drink plenty of fluids. But it's very.
Excuse me for interrupting. I have to use constant cold compresses to cool my face, and I've been on Xanax and Triadvil for 35 years.
All right, we're gonna.
Okay.
So it's more important to take the shot, though. I think that's the bottom line. You don't want to get the flu at this time. So Grace, this is the prize for winning. Do you have a possible answer?
What is it, for candy or candy bar?
Candy bar.
I'll say Three Musketeers.
All right. Is it the Three Musketeers? Oh, Grace, and I wanted you to win this shirt. I think this would have looked so. Would you like this shirt?
Yeah. Yes, I would.
Okay, it was hesitant, but all right, I can understand that. This shirt is great. This will take rust off of that.
I won 2 plaques about a year ago.
I know. She won two back-to-back weeks. So, Grace, I'm glad you got the flu shot, and I hope you're feeling better, so next week we'll hear from you. Okay? Thanks, Grace. Now we're going to go to Penny, who's on line 2. Hi, Penny.
Hi, Dr. Garner. How are you? It's Penny.
Penny, where are you calling us from?
Brooklyn, New York. I spoke to you last week.
I remember.
Hi.
How you doing?
I went to the dentist. I had 3 teeth pulled.
Oh, Dr. Sconzo.
That's right.
Is there a
first,
question?
I want to give you did that lady answer the question?
No, she didn't get it right.
I got it.
You think you know it?
Hershey bar.
Okay, wait a second. I'm going to ask our judges. Is it the Hershey bar? Oh, Penny, I thought you had it.
Oh.
I would have gone with Hershey bar. I like that one.
It's not Hershey bar?
No, it's not Hershey bar. We're going to guess with almonds or dark chocolate?
Oh, God.
No, I know it's disappointing. You don't even feel like talking to the dentist now, probably.
No, I don't.
No, I knew it.
Thought to you
She's
without
very
the
upset.
teeth.
But he's happy, right? You don't like too much chocolate.
No, not good.
But what about 3 teeth? How much 2 teeth pulled at one sitting?
Yeah, I had I'm diabetic, but my terrible teeth. Horrible. Anyway, I have 2 questions. What over-the-counter can I buy to whiten my teeth?
Oh, okay. How does she whiten her teeth?
You have Crest White Strips. That's probably the biggest one out there, and you can use a different toothpaste. Most of the toothpastes have whitening, depending on which one you get.
So
Probably Crest White Strips is.
And when they pull the teeth, why do the shots kill?
Why do the shots kill?
The shots hurt you?
Oh. I think it depends where you get. Sometimes they could
mouth.
rub a little jelly on the gum that numbs up the gum before the shot.
Doesn't stop.
So see if that helps next time.
The jelly? Like
yeah,
the
it's a topical anesthetic.
Okay.
It's painful. I know when they pull that thing, you feel them yanking that out.
I don't care about the teeth. It's the shots.
The shot. All right.
Well, have them use a little topical anesthetic next time.
Penny, I hope that
what
helps.
do you suggest? Ambisol?
No, the dentist will use it.
The dentist.
He rubs it on the gum first before he gives you the injection.
Okay.
That takes a little of the sting away.
Thanks, Penny.
Thank you.
Feel better.
Thank you.
We're going to go to Pat now. Hi, Pat.
Hey, Dr. Gaunt, how you doing?
It's good to see you. I saw you a couple of weeks ago.
Yeah, I was next to you in the car, remember?
I know. I'm in the car. All of a sudden, I see this guy waving, banging, and I got nervous. I pulled up the windows, and then because I had never met you, Pat.
Yeah. How you been, all right, Dr. Gaunt?
Yeah, how's your cousin?
He's my nephew. He's doing well. I saw you got married up in Aruba about 6 months ago.
He was paraplegic, right, from a diving accident.
Yes.
Yeah, so I'm glad. How are you feeling?
Dr. Gaunt, I'm not really feeling too good. I got to be honest with you. Every time through the years I've been getting the problem. When I get that acid in my chest, I get very lightheaded and dizzy. Now when I lay completely down flat, the room starts to spin.
Okay. Let me ask Dr. Heitner. You see a lot of people coming with this pain and stuff. How do we know it's not heart disease?
One question is, are you having the pain and the dizziness at the same time?
No. No. No, it's the dizziness when I put my head flat, the room starts to spin and I jump up right away.
Yeah, that's kind of consistent with something called benign positional vertigo, which is related to the little things in the ear that if you move your head in a certain direction can cause you to get imbalanced and cause dizziness. There are some maneuvers that your doctor can do to help try to fix that.
Right, and also when I get acid and the acid comes up in my chest, I start getting lightheaded, and it actually puts me into a panic attack, and then I'm a mess then.
John, you've had panic attacks in the street. I know you had trouble in the past. And are you under treatment now?
Yes.
Excellent. So I think you're doing the right thing. It sounds like it's not serious. It's probably not the heart. Probably the lesser of the two evils of the different types of vertigo.
Right.
And,
well, when I put my head back, just when I lay flat down, the room spins.
Yeah. So, I mean, there's some medication. People sometimes take meclizine and so on.
Right.
There's non-drowsy Dramamine. But it's something that's unfortunate. Hopefully, it's only part of the year that it happens, right?
Typically, it's temporary.
Yeah, it happens actually this time of year, every year.
Yeah. So, Pat, it's great to hear from you. Nice to meet you in the street there, too.
Doc, how about that? I got a shot at that.
The shirt?
I want that the candy, the question.
Okay. Let me.
You forget me, Doc.
Okay, what is it?
It's a Snickers bar.
Is it the Snickers bar? Whoa, Pat, you got the Snickers bar. What do you think about that?
I'm in the candy business, Doc. That's what I do for a living.
Wow, so you know, Pat, that's like a ringer, right?
Yeah.
Pat's a ringer in the business. How come you never sent any candy over to ask the doctor?
I'll send it over next. When are you over? Every week, Doc?
Yeah, well, I don't want to give you too much information.
Okay, no problem. Doc, you're gonna have to get a bigger shirt than that. The only thing I do with that one is hang it up on the wall.
Double X.
That's good. That's good.
I don't know what it is. All right, but Pat, do you know that I was surprised that the Mars company, I always thought Mars bar was related to Mars, is the name of the man, Mars.
Yes.
They stopped selling it in 2002, Mars bars.
Yeah, they discontinued it. But the Snickers bar is #1, M&M peanut is #2.
Wow, excellent, great fun to knowledge. You're going to get the shirt, you're going to get the plaque, and we look forward to the candy.
Great, Doc, very good.
Great to talk to you.
You know what I'm going to do with the plaque? When I get dizzy, I'll hit myself in the head.
Very good, very good. Okay.
It's not gonna work.
All right. And just send them the shirt, okay? All right, now we're going to talk to Claire, who must be devastated because I think she had the answer to the quiz. Hi, Claire.
Hello.
Hi, Claire. Did you hear the bad news? She can't even talk. Claire?
No, I hear the television.
Yeah, you got to turn down the TV because we have a 7-second delay.
Right, but I'm not clear.
You're not clear?
No, I'm not
Okay,
clear.
but who are you?
My name's Judy.
Oh,
I
Judy.
wanted to ask the dentist something.
Sure. You got a question for Dr. Sconzo?
Yeah, I don't know. It's I had a crown that came out, and the next tooth was an implant, and there's nothing left for the dentist to put another tooth down.
To put the crown back on the tooth.
Right, because the post came up. The post came down.
Right.
So he's suggesting that I pull the tooth and do another implant, which I don't want to do.
Well, that's probably the most ideal thing to do.
I know.
Short of that, you could have something removable, but
yeah, well, there's nothing to attach it.
right.
That.
Why don't you want the implant again?
Oh, I don't know, because it's going to cost like $1,000. You have to. Oh.
All right.
But
So,
that would be the best thing to do, though.
You have to have it.
To remove the
whatever's
tooth and
left,
put another
pull
implant
it,
in.
do an implant, and then you're finished.
So we'll get that implant in there, okay?
So basically, there's nothing else that you could do.
Seems like Dr. Sconzo thinks you should get the implant.
Okay, thank you.
Okay, now let's go to James. Hi, James.
Hi, how you doing?
Where are you calling us from?
Middle Village.
Middle Village. Again, I always like to know what's out there to eat. Where do you eat in Middle Village?
You heard of London Lenny's?
Oh, is that Middle Village? And you know London Lenny's? On
Yes.
Woodhaven Boulevard. That's a nice place.
The Woodhaven House?
The Woodhaven House? Is that down the block?
Yeah, it used to be Kate Cassidy's.
Oh, Kate Cassidy's. All the nurses from St. John's used to go there after we finished the emergency room.
And Bridie's is back also.
Fridays?
Bridie's.
Very nice, very nice. So it's a good place. Anybody wants to go out there, it's a good thing to know. What can we do with you? Or for
Well,
you?
I have the answer to the quiz, but that's okay. I wanted to tell you that.
Are you on an 18? He's on an 18-minute delay. So somebody got the quiz.
Yeah, I know.
Were you going to guess that answer?
I know with Snickers. I know.
What's number 2?
M&M's.
Yeah, very good. Okay, next time, next week.
I wanted to ask you. I had breast surgery. I had breast cancer, so I finished my chemo, and now I'm having radiation.
Okay.
And every 3 weeks I have to have Herceptin.
Yes.
So I don't get a reoccurrence.
Right.
But
You sent us an email.
Right.
Okay.
I want to know about the damage that it could do to your heart, because I had 2 Mugger tests, and one was 74, and the last one was 66. And what's the cutoff?
Okay, I'm going to ask Dr. Heidner, because those numbers, he's got some good news for you, I hope.
One of the things you mentioned, you're getting, did you get radiation therapy as well?
Yes.
Yeah, so the radiation can certainly lead to long-term trouble with the heart. It can cause blockages in the arteries. It can lead to trouble from the heart muscle itself. That usually is around a 10 to 15 year delay or so, up to 10 years. It looks like, though, your ejection fraction was quite good by the numbers you just mentioned. So I would just follow up with your doctor very closely.
Now, Jane?
And my right hand is like tingly since I've had the Herceptin.
Yeah, I don't think that's related to the heart. It may be a complication from the chemotherapy, though.
Did you have an axillary dissection? Did you have a lymph node? Did you have surgery to the arm?
Yes, I had 13 lymph nodes removed, 7 were positive.
Okay, and that was in the right arm?
The left.
The left, okay. Well, you got to be careful.
No, but the right hand is the one that's tingling.
All right, maybe related to radiation? It's possible. But look, you're one of our favorite callers, so please call us back, all right? And I appreciate the email.
Okay.
It was very nice. Thank you.
All right. Have a good day.
You too. Take care. Okay. All right, we've got a lot of work here. I feel like, but we still got a lot of show to go. So what we're going to do is we're going to take a short break, and we're going to come back and go right back to your questions, where the topics are oral and dental surgery, geriatric medicine, and cardiology. Okay, so don't go anywhere. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are oral and dental surgery, geriatric medicine, and cardiology. We have Dr. James Sconzo, Dr. Emil Bakash, and Dr. John Heitner. Now let's go right back to the questions. Okay, who is this?
My name is Martin.
What can we do for you tonight, Martin?
Is it possible to have a question for the dentist?
Absolutely, he's right next to me.
The question is in reference to an abscess.
Right?
An abscess is an infection, to my knowledge. Am I correct?
Correct.
Can the infection be cleared up, or normally they just extract a tooth?
No, it could be. It depends what the infection's from, what type of abscess, what's causing the abscess. You could have a gum abscess, a root canal abscess, but you could have it treated without losing a tooth.
Through medication or through surgery?
With medication, well, medication will help get it under control, but if you don't take care of the problem itself, it's going to come back when you're off the antibiotics. So if it's something from a root canal, from the inside of the tooth, you need to have root canal done.
All right, so the tooth doesn't have to be extracted?
Not necessarily.
But in general, does that happen a lot, though, where the tooth is extracted?
Sometimes, depending on the condition of the tooth, you may need the best thing may need to be extracted.
Martin, are you going to a dentist now?
Well, this is something that I've had in the past.
Okay. So
and in the past, they seem to be very fast to extract it rather than to try to clear it up. First thing is to take it out, it seems.
It really depends what's causing the abscess, what the condition of the tooth is.
All right.
So you need to see your dentist and have him determine whether it's savable or not.
Has the procedures been different now than in the past? Seems in the past they were very quick to extract rather than try to clear it up.
It hasn't really changed. It really just depends on the condition of the tooth, whether it's salvageable or not.
Martin, so it sounds like you got to get in and see the dentist so we can try and save that tooth, okay?
Yeah, okay.
All right, be well. We're now going to take an email from Mary in Flushing. My friend suffers from frequent urinary tract infections. It's only relieved by doses of Levaquin. She went for a sonogram and the technologist said she might have a cyst. She's not diabetic but is overweight, hypertensive, and needs to control it. What's your opinion on what course of treatment she should explore? I enjoyed the show and I took the survey. Thanks, Manny. Thanks, Mary. Okay.
Sure. Well, renal cysts are very common. I think about 20% of adults have renal cysts, and they usually have no consequence unless they're complex cysts or they're found on serial sonograms to be increasing in size. Persistent urinary tract infections are extremely common. There's a lot of causes for them. One cause could be that the bacteria is resistant to the antibiotics. Another cause is that you're not emptying your bladder completely, and that can happen from a stricture, or it can happen from post-menopausal symptoms. You know, if there's atrophic outside of the vulva, there's a lot of reflux of bacteria into the bladder. And so if somebody is sexually active, bacteria can get in from the outside in. So there's hygiene issues that are important. You can also, besides taking multiple antibiotics, you could take vitamin C, like 500 milligrams twice a day. That'll acidify the urine, which is bacteriostatic, meaning that the bacteria won't grow as quickly. And drink plenty of fluids. That's important. If you continue to get persistent UTIs, you need to have urodynamic studies to see if your bladder is emptying properly, because if it is not emptying properly, you may need to be dilated so that it does empty properly.
Thank you. Thanks for that answer. Mary, I hope that helps. We're going to go to Frank, who's on line 2. Hi, Frank.
Hi.
Where are you calling us from, Frank?
Brooklyn.
Which part?
Bensonhurst.
Bensonhurst. Beautiful old area in Bensonhurst. A lot of people have their roots there. Still have some nice places to eat out there, right? Tommaso?
Tommaso's, New Corner.
New Corner. Was that like a diner or that's a regular?
No, it's a real restaurant.
Regular
Restaurant. Great restaurant.
Really?
Yeah,
Where is that?
It's on 8th Avenue and 72nd Street.
Right.
I think, yeah.
It's right near the highway.
Very nice. What can we do for you tonight?
My mother had implants done.
Well, the dentist is getting a lot of work here tonight. You're killing him here.
She had implants, and she was missing a little bit of bone, which the oral surgeon put in when he put the implant. Now 2 years have passed, and she has like a little pocket. And she went back, and it was a little bit of an infection, and the oral surgeon said he has to put more bone back in there. How does that work? Is that cutting of the gum to put the bone in, or is that injected in? Or?
If they can do that, they would need to cut the gum, reflect a flap, and then add some bone particles and probably a membrane over it. It's just tough with an implant because that doesn't get the bone supply, so it's not too great of an outcome with that usually.
So, what is his prognosis?
Depends how much bone loss is on the implant already.
All right, Frank. So
He said it was minimal, but he said
Well, that's good for her. I mean, the least amount of bone loss you can have is best. When you have more bone loss, the prognosis is worse.
And also, it's always good second opinions, right, in dentistry as well. You want that second opinion
Absolutely.
to make sure. So you have a number on the screen if you want to call. We can always help you find somebody.
New York Methodist Hospital.
Okay, so Frank,
All right,
let us know how it works out. I think we might have the birthday boy on line 4. Hi, Joe.
I'm here.
Joe, where were you? What happened?
Huh?
What
Nothing.
happened?
Nobody came on.
Oh, Joe. So 94?
Nobody.
94 years old?
That's where I am.
Amazing. When is the day? Today?
Huh?
When is the day?
September 2nd was my birthday.
What was it, 3 weeks ago?
But I don't forget. I feel like 49.
That's good. He's,
I just got back from that joke to see Virginia back and forth. I go anywhere.
Can you still be wishing happy birthday from September 2nd? Is that right?
Sure.
All right. But Joe, and I told them you're on all the boards and stuff. I know you're on the board of Community Hospital, and they're doing a film.
Well, I'm senior member of the board. I'm an executive of New York. I am the vice president of all the Church of Brooklyn, Queens, with the holy name. I am the senior member of the Chamber of Commerce, and I'm the ambassador of Brooklyn.
Amazing. You're really a privilege to be friends.
I belong to Marie Park Civic, and I belong to committee board. And, you know, I'm a very active guy. I'm always on the go, and I help a lot of people out. My life is, if I can't help you, I'll never harm you.
Thanks, Joe. Joe, happy birthday. We'll get together for lunch, I hope, soon.
Oh, I hope so. You let me know.
Okay, be well. Many more. Hi, Mary.
Yes.
Mary, what can we do for you?
Yes, I'd like to ask a question to Dr. Bakash.
Oh, he's right next to, he's right here. What can we do? What can he ask?
Yes, my father's been on an antibiotic for 10 days, and he didn't have any problem with it. And now for the last week, he's been having problems with diarrhea off and on. I'm just wondering what I could give him to calm his stomach.
Sure. Well, antibiotics can cause infections also. Ironically, they can cause the growth of this bacteria called Clostridium difficile, and it produces a toxin. So if they have persistent diarrhea after the use of an antibiotic, you may have to take a drug called Flagyl or metronidazole. And is he taking a probiotic like yogurt, Activia, something like that also?
I give him a probiotic twice a day.
Okay, that's great.
But I give him some yogurt too, I guess.
Yeah, that really helps because it competes with the bad bacteria. So I think empirically, in a situation like this, besides avoiding dairy products, I would put him on metronidazole, and and if that doesn't work, we get stool cultures and see if he is growing that out, and if it is, then and the metronidazole didn't work, we'd go to vancomycin, which is a different drug. So,
Mary, thanks a lot for the call.
Right.
We've got so many calls. We're going to move ahead. I got to ask Dr. Heitner a quick question. I'm out there. I think I have chest pains. I hear non-invasive imaging. What can you do for me where I don't have to have a needle put into me or anything invasive?
You can do get you on a treadmill, Steve, and just hook you up to the EKG, exercise you on the treadmill while we're monitoring you. And I think it's a very good test to screen for coronary artery disease and evaluation of chest pain.
And what about with the MRI? What are you doing with the MRI?
The cardiac MRI is sort of the Rolls Royce of imaging for the heart. You get absolutely spectacular images. You can see the heart muscle like no other imaging modality. And it's really considered the gold standard for a number of different
And I know you're talented. He really is one of the best in the city. And it's compassionate. You get in to see him. I think it's good. You know, I've used them, and I highly recommend them.
Thank you, Steve. Appreciate it.
Thank you very much. Okay, we have Elizabeth on line 2. Hi, Elizabeth.
Hi, how you doing?
Where are you calling us from?
I'm calling from Brooklyn, New York.
Which part?
Park Slope.
Oh, not far from here.
Yes.
Yeah. Did you eat at any of the new restaurants that opened in Park Slope recently? There's a new Italian one, and a Greek one.
The Green Kitchen.
The Greek Kitchen?
Yes.
Is that in Park Slope or Manhattan?
Park Slope.
The Greek Kitchen. I'm not sure where that is. Interesting.
11th Street and 5th Avenue.
Ah.
Okay.
And there's a really nice place for brunch I ate at Applewoods. Is it Applewoods? I think it's called. It's on 14. I think it's on 14th Street off of 7.
Yes.
Very nice. Little expensive, but very nice.
Right.
And I ate at a place, Henry's End, this weekend. If anybody remember Henry's End? Kind of an off-putting name to the restaurant.
Remember Henry's End?
Henry's End, yeah.
Okay.
It's actually at the end of Henry Street, but I didn't know exactly. But you get in there and they have venison and they have all game and fish. It's a little cramped, but it's a nice little place.
Yes.
No reservations. Oh, yeah. So anyway, you remember what you called for?
Okay, yes. My sister has just caught a stroke. And she's been like drinking a lot, but she's like an alcoholic, okay? And I just want to know, like, what should I do to help her with? Because I'm afraid, because she's not acting normal. Like, she's sleeping all day, and she's not acting normal. Speaking.
Did she have a stroke, you said?
Yeah, she had a
So
stroke.
she had a stroke and now she's an alcoholic.
She's been an alcoholic, yeah, and she had a stroke. She was with the same man for 28 years, and he wound up playing her dirty, and yeah.
Yeah, no, I like both Dr. Bakash and Dr. Heitner to address this. First, from the stroke side, on alcoholism and strokes? Any relation?
You know, there is some relationship certainly with alcoholism and heart disease. Typically, you'll get a cardiomyopathy where the heart becomes a bit weak. When you have heavy alcohol use, it certainly could put you at a little bit of a higher risk for strokes through hypertension.
Not a good thing. What about Dr. Bang?
How does this fellow get the alcohol? Is he walking around? Is he after the stroke? Is he ambulatory? He's able to go to the store?
Oh, my sister, she was ambulatory.
She was. She still is? She can walk around?
She could walk, but her arm is like limp, like.
Okay. Well, it's very important at this point forward that she not drink. I mean, that's saying the obvious, but it's really, you know, extremely important because there's a lot more that can happen to her. So there shouldn't be anybody that enables her, you know, to continue doing this. That's one thing. And then, you know, she may need some help in doing this. I mean, she's up and about. You know, there's of course Alcoholics Anonymous, and then there's private services also. She can actually even go away. You know, there's places, hospitals, and clinics that she could stay overnight for a few weeks, and they can, you know, what's called detoxing her, and then, because if she continues to drink, she's not going to do well. That's.
Yeah. How old is she?
My sister's a year older than me. She's 44.
Oh, young. So she got a whole life ahead. So I hope you're going to get her into help, and then hopefully the rest will fall into place.
Yeah. There are alcohol rehabs that she could go to, but she has to be willing to go.
Thank you so much for the call. I hope things improve for you.
Okay, thank you.
All right, we're going to go to the email, and then we're going to go to a break. So we're going to talk from an email from Navad Asnaks. Interesting name, N-A-V-E-D. And a daughter had a permanent tooth knocked out while surfing in the summer, and the fake tooth is the wrong shade. So they put the wrong color tooth. Well, how does that happen, Jim? What is this?
Could be colorblind dentist. You need to go back to your dentist and have him take the crown off and remake the new crown.
How do you match these up? Are there different shades?
There's different shade guides, and there's actually digital shade guides now too. You just put a meter up to the tooth, and it digitally records the shade. So if you're bad with your eyes.
Does anybody request like a gold shade?
Not too many, but a couple
you don't get too many rappers in
Not too many more. No.
But anyway,
it can be redone without a problem.
So hopefully that's good news. It could be redone. We're going to take a break. We're going to come back to our busy calls for our wildfire round, I call it. And when we come back, we'll go right to our doctors from oral and dental surgery, geriatric medicine, and cardiology. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are oral and dental surgery, geriatric medicine, and cardiology. Before we get to the questions, I want to tell you a special next week's show. We have a urologist who has her own radio show on WABC at 7 a.m. in the morning, from 7 a.m. to 7:30. And her name is Philippa Cheatham, a British woman, interesting accent. She's a big shot in urology at Columbia. And she does holistic approach. So she talks about herbs, and she talks about, as well as the traditional. So for all those with prostate issues or questions, tune in for next week's show. Okay, now we're going to head right to our busy calls. And who are we going to get first? Okay. Hello?
Hello?
Yes, hi, who is this, please?
Hi, this is Mizia.
Mizia?
Hi.
That's a nice name. What does that mean?
I don't know.
Mizia.
My father gave it to me.
It's a beautiful name.
Thank you.
Where are you calling us from?
I'm calling from Brooklyn, New York.
Yeah, which part?
Bushwick.
Bushwick, yeah. Any place you'd like to go out to eat in Bushwick? No.
I don't know.
No, you're not up for it right now. Are you okay? What can we do for you as far as your health condition?
Well, I don't know if this refers to what they're talking about. I went to the doctor recently, and they found out that I have fibroids.
Fibroids, okay.
Yeah, and I know they tell you that it's nothing to worry about. What I want to know is, like, if you're taking birth control, will that make it grow? Will it affect it?
You know, let me just tell you that fibroids are affected by hormones. And there's non-invasive, another show we're going to do this on, non-invasive techniques where we can use catheters such as what Dr. Heitner was talking about, and we can actually shrink these fibroids, and it allows you to become fertile. So I really don't want to get into it now, but call us back when we have our gynecologist on, okay?
Okay, is there a website I can go
We have the
to find
website,
out?
netny.net/askthedoctor, and you'll see our website.
All right, thank you so much.
Take care, Mizia.
Thank you.
I see we have an email for Dr. Sconzo. Somebody wants Dr. Sconzo to explain the difference between a bonding and a veneer, and which is better, and it's from Rebecca.
Rebecca, two totally different procedures. One, use almost a putty material to put on the tooth. Actually, this was bonded, okay? You just freehand shape it in the mouth. Have one other one here. This is actually a veneer. This is before and this is after, okay? So veneers are made out of glass.
Let these people see them right here. Yeah. Monsignor can't see.
Monsignor?
Okay. Yeah.
Veneers are glass that, it's almost like a nail tip that gets glued onto the front of a tooth. You just have to remove a thin layer of the front, take an impression, goes out to the lab, and it comes back and it gets glued on top of the front of the tooth. More color resistant, does not stain, very strong. Bondings tend to lose their shade after a while, can darken, and they dull up after a bit. So depends what the problem is.
What does it cost, like comparison, the same teeth bonded versus veneered?
A bonded tooth, it could be almost double the price.
Really?
Veneer compared to a bonding.
So we hope that helps you, Rebecca. And we're now going to go to Maria on line 4. Hi, Maria.
Hi, Dr. Gardner.
Good to hear from you.
Good to hear from you, too. I'm glad you're back.
Yeah, no, I know. You got it. Did you fill out your survey?
Yes, I did.
Very important, yeah. They want to see that evidence that people are watching.
Well, this is my favorite channel, you know, the Net channel.
It's a great channel, right?
Yes, it is. They have very interesting programs.
What's your favorite show?
Yours, actually.
Okay, just very good, very good. So where are you calling us from, Brooklyn?
I'm calling you from, I'm right at the borderline. I'm right across the street from Queens. I'm in Brooklyn, yes.
Is that where the Interborough, the old Jackie Robinson?
No, I'm closer. I'm down here by Cypress Avenue.
Oh, okay. Heading towards downtown Brooklyn?
Yes, sir.
Very nice. I like that area. You ever go in the diner near there on Court Street?
No, well, this is not downtown. This is like Cypress and Harmon Street in Brooklyn.
Oh,
you ever heard of Knickerbocker Avenue?
Definitely, yes.
Okay, I'm close to Knickerbocker.
Oh, very nice. What can we do for you tonight?
You know, I had a surgery a year and a half ago. I had osteomyelitis. I contracted a bacteria in my back, and they had to put all kinds of metal. They built all my bones out of metal, and I'm in a lot of pain. And I want to ask a question because I got to be on antibiotics the rest of my life.
Which part of the body was the osteomyelitis, the infection of the bone?
On my spinal cord. They had to put metal. They had to make my bones out of metal.
Okay, so there was an infection in the spinal cord.
Yeah,
and they had to when they took out the infection, they had to hold things together, so they put metal in.
Yeah, I'm all full of metal, so I'm in constant pain. The question I want to ask you is, I'm on Avalox, 400 milligrams, and I got to take this the rest of my life. Is that a good idea?
Is that true, Dr. Bakash?
What is the name of the drug?
Avalox.
Avalox. Yeah, I've actually had patients who've had prosthetic surgeries like knee replacements and hip replacements who develop MRSA or Staph aureus that's resistant, and they are on antibiotics for the rest of their life. So it's not, it happens, unfortunately, but the alternative, especially when it's near the cord, if they've given you IV antibiotics and they've eradicated the bacteria, you will not need it for the rest of your life. So it really depends on your individual case. I had one guy who had totally paralyzed. He was treated for his transverse myelitis. It was due to an infection. He was cured. He's walking around normally now. So, and he doesn't take any more antibiotics. So you might be in that second scenario. So you just need more imaging studies to see and cultures. And if you're neurologically better, you know, if you disregard the pain but able to function and move around, and the infectious disease doctor clears you, you may not need them for the rest of your life.
That's good news.
Well, thank you very much. It's very interesting.
Great to hear from you. Keep listening.
Thank you, Stephen, and I love you.
Oh, my wife's watching. Otherwise, I would say something. Okay, take care. Actually, she won't watch this show, so I don't know. Jean.
Hello?
Jean, how are you?
Okay, fine.
Where are you calling us from?
Brooklyn.
Which part of Brooklyn?
Sheepshead Bay.
Sheepshead Bay. Beautiful area out there. How does it? Monsignor
very nice.
Do you have a boat out there?
What?
Isn't it beautiful, the boats out there?
Yeah, the boats are, very nice.
You ever eat at the El Greco Diner?
Yeah, Greco, yeah, yep.
Nice place. And you know what? You can buy
Very nice.
fish at the end of the day. Have you ever bought fresh? Have you ever bought the fish at the on the docks when the boats come in?
Oh, yeah, when they sell the fish, yeah, very nice, yeah.
That's
And
nice.
The boats, the water, very nice.
What can we do for you tonight, Gene?
Okay, I'm 58 years old, and I go to a stomach doctor for a long time, and he put me on this medication called Lexapro because I'm losing a lot of weight.
Lexapro.
Yeah.
And how long have you, this is a psychiatrist?
This is a stomach doctor.
Okay, I'm gonna have to ask, can you translate that to me? A stomach doctor.
Yes, my stomach doctor gave me this.
Stomach doctor. Okay, so you had problems with your stomach.
Yes, I do.
Okay, and what did he give you?
He gave me Lexapro to take.
Okay.
Lexapro. I'm not familiar with Lexapro. There's a drug called lansoprazole, which is a proton pump inhibitor. You know, stops the acid, but I don't know one that's called.
Maybe that's what she's got. It's to stop the acid buildup.
Yeah, and plus because I'm losing a lot of weight. I used to weigh 130 pounds. Now I went down to 85.
Oh, okay.
And I'm losing a lot of weight. I have no appetite.
What is your question?
My question is, how I want to gain weight, but I keep losing. So that's why he put me on this medication. Okay. Sometimes I eat, sometimes I don't, but I'm losing the weight. I want to know why I'm losing weight.
Okay. Any tips on? Let's go around the panel. Tips on gaining weight, Dr. Heidner?
Well, I think that the real question is why you're losing weight, and that would really require a pretty extensive workup. Obviously, you know, we always get concerned in weight loss such as that of 50 pounds. That's certainly a very concerning problem and would need to be extensively worked up.
Right.
Emil, what about old? What's 58?
Well, you know, the thyroid, of course, is needs to be checked to make sure you don't have hyperthyroidism. Looking for a malignancy, you know, which is important. Making sure you don't have any tumors in your lung, or doing a colonoscopy. Make sure you don't have anything that would, you know, make you lose weight. And when all else is exhausted, you might, you know, if there is psychological issues or stress issues, you know, sometimes they do use antidepressants. But the first line of business is to make sure you don't have anything that's doing it related to your health, like a malignancy, which means cancer, or thyroid disease, or malabsorption, when a celiac sprue, which is lack of absorption with wheat. I mean, there's so many different causes.
Okay, I hope that helps you. Did it help you?
Yeah, but no, the doctor, I ran all these tests. The doctor gave me all these tests. The colonoscopy I went for, the endoscopy. I went for every test, and they didn't find anything wrong.
Which is good, and maybe we think he may give you antidepressant medication to improve your appetite. Let's think about that over the weekend. Call us back next week, okay?
Okay, thank you.
Thanks a lot. Yeah, is this Nigel?
Yes.
Hi, Nigel. How are you?
I'm okay.
Were you ever known as Brian previously?
Yes, no. I called already on the show.
Yeah, so what can we do for you tonight?
Yeah, I have a head injury. And the doctors, they told me that they will do a brain surgery. And when I spoke to you, told me not to let anybody do any surgery on my head. But then after they told me there's problems going to happen to me that I don't even know about. And the problem that I'm getting now is that from my waist down, it's losing life, it's getting lifeless, like if my feet fall into sleep. Because I could get crippled, and I wanted to know if that is the stage I'm meeting to.
Are you able to walk?
Yeah, I walk, but sometimes when I walk in my foot stays just like if it want to give away from under me.
Just refresh our memory. How did the head injury? What was the injury?
The injury was being electrocuted with 11,000 volts, and from the.
Oh, right. He was a workman, and he got 11,000 volts of electricity.
Wow. Yeah.
Was that hit by lightning or by electrical wire?
By electrical wire.
Right. It's a miracle. That. Yeah. I mean, usually, Dr. Hyde, have you ever seen? Apparently, they die of heart arrhythmias.
Yeah, interesting. You can have a very odd fibrosis of the heart from the electrical current that goes through.
But it's not a typical case. Very few people can survive 11,000 volts of energy going through the body. So where do we stand now? Do you have a specific question for tonight?
Yeah, I wanted to know concerning the foot.
What's going on with the foot is we have a progressive weakness in the lower extremities.
Yeah, my foot, sometimes when I'm walking, my foot is just like give out from under me. and I have to stop. I can't sit down. Like if I'm losing life in my foot.
Nigel, because we don't have enough time to do this justice. It's such a long. Can you call back next week? You'll be our first caller at 5 to 8.
Okay, I will.
Thanks, Nigel. Have a nice week.
Okay.
And now we're going to go to Dorothy, who's our last caller for this show. Hi, Dorothy.
Hi, how are you?
Okay, where are you calling us from?
Staten Island.
Great to hear from you. We didn't have too many Staten Islanders tonight.
Oh.
But it's a great borough, right?
It is, of course, the best one.
Which is your favorite restaurant out there? The one upstairs, the fancy one?
No, I go to Kilmeyer's.
Kilmeyer's. All right, we're going to have to ask, give us in 10 seconds what the question is.
I'm interested in the non-invasive imaging.
Dr. Heitner, again, non-invasive imaging?
Yes, which is best when you have multiple problems?
What are you looking for it to answer?
Well, the doctor wants to check me for stones and blockages in the bile duct, and he wants to check the gallbladder, the liver, and the spleen. He's checking everything. So which is the best way to go?
I'll actually defer that to either Dr. Bakash or Dr. Garner.
You know what we're going to say, because we have 2 seconds left. The best way to go for all those things probably is a CAT scan. A CAT scan of the abdomen and pelvis should be able to pick up everything that you mentioned. They may have to give a little contrast to make you feel a little warm, but we should be able to see what's going on. Okay, so first they would do it without contrast to see the stones, and then with the contrast to see if there's any blockages. Okay?
All right.
Hope that helps. I mean, we got a lot more callers, but that's it for this episode. Just flew. Did I tell you it was going to be a great episode? I want to thank Dr. James Sconzo, Dr. Emil Bakash, and Dr. John Heitner for coming in, and we hope we've been able to help you. Now remember, you should always be proactive about your own health. Speak to your doctors about your concerns. We've had this all night. We've been talking about this. Go for second or third opinions. Now next week we're going to have that special show I told you about. We're going to have family and community medicine, urology from Dr. Cheatham, and cardiac catheterization. We want you to visit our website at netny.net/askthedoctor for the tablet, the weekly column that I write for the tablet, the podcast, the forum, and if you want to email questions in advance to participate on our viewer survey, you can do all these things. So don't forget that viewer survey, very important. And for those who participated already, thank you. And most thank you to Dr. Linda Lapatosa, our quizmaster, and I want to thank you for your questions. Also, tune in tonight at 10 o'clock. You can see the encore presentation of last week's show. It was a great show. So I hope you're going to tune in at 10 o'clock. I know I'm going to be watching. So goodbye, and see you in the tablet.